Another COVID restriction will be lifted. Starting Monday, COVID patients with no symptoms or mild symptoms will no longer be required to self-isolate. Online consultations with doctors for infected people will also become a thing of the past. Many doctors of small clinics are now genuinely worried. They're afraid that their waiting rooms may become virus hotbeds. They say the gathering of infected patients in a confined space will likely increase the spread of the virus, raising the risk of infection for medical personnel. Some doctors came out on Sunday calling on the government to first institute a buffer period that still retains video consultations for infected people.
Early Sunday morning, this pediatric clinic is already filled with visitors. Starting Monday, COVID patients with mild symptoms will not be required to self-isolate. Video call consultations with doctors will also be a thing of the past. Some people are apprehensive.
People who are supposed to self-isolate will come out, which may cause the spread of the pandemic. So there may be some risks. Those who haven't been infected may be more worried about being infected. I think it's okay. We'll just see how clinics separate infected and non-infected cases. There is a shift in mentality. Yesterday, people were still quarantined, but today, things are suddenly relaxed. The policy stipulates that although there is no mandatory self-isolation, voluntary isolation is still encouraged. So we can see that we have not yet fully transitioned to regarding it as a common cold. So I think we still need to create a buffer.
Now that people no longer have access to video call consultations, doctors are worried, as waiting rooms in their clinics tend to be small and cannot adequately separate infected and uninfected patients. The last thing they want is to see their clinic become a hotbed for COVID.
If you have all these infected patients congregate in one medical institution at the same time, the virus density in the clinic will actually be really high, and that is a big risk for our medical staff. At the same time, some of the people who come to the doctor are high-risk seniors, children, or people with chronic diseases. The risk of infection will increase, and it may cause a more rapid spread of the disease.
Some doctors in the infectious diseases department believe that as COVID comes to be regarded as a normal disease, the responsibility for protection will fall on individuals. As long as people are fully vaccinated, most patients will not become severe cases and die. The Central Epidemic Command Centre will continue to monitor the situation. If infection numbers remain low, rapid test requirements for hospitalised patients and accompanying family members may be lifted in early April. The mask mandate for public transport may also be lifted in mid-April.